Welcome to the Love Letters to Our Bodies podcast. I'm your host, Gwendolyn Mitchell, founder and CEO of Moyo Institute and lifelong spiritual seeker and energy worker, here for thoughtful conversations about health, healing, and happiness by, for, and about Black and African American women. Disclaimer, the Love Letters to Our Bodies podcast does not provide medical advice. The opinions, experiences, and insights shared are for informational purposes only. Nothing shared in this podcast is intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other healthcare provider. Don't disregard or delay seeking it because of what you've heard on this podcast. Thank you. Are you ready? Let's dive in. I'm Gwen Mitchell, host of Love Letters to Our Bodies, a podcast for, by, and about Black women. I'm so excited today to welcome Chiquita Tuttle as our guest. She's an incredible woman with an incredible background, and I'm sure you're going to be delighted to hear from her. Let me just tell you a little bit about Dr. Tuttle. I want to give you your props because she is Chiquita Tuttle, PhD. So let's start with Dr. Tuttle. She is an independent consultant and owns marketing management and healthcare consulting company, which is an LLC. She obtained her healthcare management experience at Kaiser Permanente, a major health maintenance organization, as Director of National Accounts, Central and West Coast states. She served on several boards, including the Catholic Charities for Human Development, the U.S. Catholic Bishops, National Education Parent Advisory Board, and she was a board member of the Association of Fundraising Professionals for the Diocese of Oakland and for the Bishop Steering Committee. I hope I'm getting that correct. She's also a past fellow in the Multicultural Alliance. She's a board member for the Association of Fundraising Professionals and also a past fellow for Healing the Heart of Diversity program. She's also a Delta, a member of Delta Sigma Theta sorority, and go Deltas. She's a member of the International Diplomacy Council and a member of Center for Blacks in Philanthropy and Bay Area Blacks in Philanthropy, and the St. Benedict Pastoral Council and the Diocese of Oakland Racial Task Force. You are quite a busy woman with a lot of leadership behind you. And let me just tell our audience that she holds an MBA in Health Services Administration with a minor in marketing from Golden Gate University. And she completed her PhD at Walden University in the School of Health Services Administration program with a concentration in public health policy. Thank you so much. I'm really honored that you've agreed to be with us today and share your thoughts and experience with our listeners. So welcome, Dr. Tuttle.
Thank you so much for having me. I'm honored to be here.
Beautiful, beautiful. So let's start with a little bit more information about your professional background and healthcare expertise. Could you share a bit about your journey? I just really gave a summary of your background. I know you've been really on the front lines as it relates to healthcare and working with nonprofit organizations and healthcare organizations and capacity building. Can you share a little bit more about your background?
Of course. I've always been fascinated with healthcare. And so I started my initial journey by going to junior college. Actually, it's Peralta Junior College. It was Alameda campus. And I started in their medical assisting program. And I thought, well, I can be a medical assistant. I can help patients and I can learn more about the healthcare and decide where I wanted to go from there. So I completed that program. And interestingly enough, I completed it both with my sister and my mother, who also enrolled in it. So that was fascinating. And I was the first graduate from that program. So I was excited about that. But then when I finished the program, I said, is this what I really want to do? Or do I want to do something more advanced? And I thought, well, I'll do something more advanced. And around that time, I started my professional career at Kaiser Permanente. and started in their welfare fund administration and worked myself through a number of departments and finally ended up in the marketing department. At the time I was married, I was just beginning to have our family. My husband was in marketing, so we had two folks in the household who were doing marketing at one time, which is very interesting. But I learned a lot. I learned a lot. You learn the rules, you learn how to navigate accordingly, and then you look for opportunities. The other thing that I looked for was a mentor. I really knew that I had to find someone who would help me strategize and guide me as I moved in my career. Along with all of that, I decided to continue my education. So while I was working at Kaiser, I had the luxury of them providing tuition reimbursement, which was very important. And so I finished my bachelor's degree at Golden Gate University and my master's, as you mentioned early in the introduction. And so, I began to learn how to market Kaiser Health Plan. I learned about the healthcare systems. I had to learn about the competition. I had to learn about healthcare delivery systems. And a lot of that you learn about the discrepancies in healthcare and what we needed to do about that. So that has been my journey. And I spent more than 34 years at Kaiser Permanente, moving in and out of positions and learning how to navigate. After that period of time, when they went through a reorganization, my position was depleted, to say it nicely.
Mm-hmm.
And I decided at that time that it was an opportunity to go back to school. So, discussed it with my husband and family and said, this means that I kind of divorce you guys for a little while, but we're going to get through this. And so over the next 4 years and 5 months, I completed my doctorate degree at Walden University and I walked across that stage. It was one of those check the box of a lifetime goal. And so I did that. I'm currently right now in a different lane, if you will, in terms of my position, but I'm still using the same navigation skills, interest in healthcare and wellness, but specifically around the African American community.
Beautiful, beautiful. It's really wonderful to have had your family support, creating that space for you to really pursue the goals that you wanted to pursue.
Yes.
So, as a Black woman, as an African American woman, has your identity influenced your approach to healthcare management and leadership?
Oh, absolutely. Because during the time that I was working, African American women were not in the marketing field and oftentimes were overlooked, as many of us have experienced in our professional careers. And so, I had to learn how to be very assertive and aggressive at times and advocate for myself. So, having a mentor was really important in terms of learning how to navigate going through this journey. So, it's important when one gets a job that they identify or try to identify a mentor who will help them as they decide where they want to move within their career.
Beautiful, beautiful. So, what are some of the most significant disparities you've observed in healthcare delivery for Black women? And do you have any suggestions for how they might be addressed?
Well, I think the basic disparities is that oftentimes women get ignored. They don't get the care that they are entitled to. They don't get asked certain questions. And we also know that if we look at the research, it shows that there are these discrepancies. If you look at the percentage of African Americans who have incidents of disease, heart disease, lung disease, breast cancer among Black women, it's because either they're delaying going to care or when they go into care, they don't get the appropriate care early enough to take care of the issue. So women have to be assertive. They have to find someone to go with them to ask the questions on their behalf if they are afraid to ask the questions. But they also have to do their research.
You're right. And, one of the things that we talk about in the Love Letters to Our Bodies workshop, because we've had several women who shared their stories of having gone to the doctor. One person that comes to mind right now is Talea Dindi. She's really young and very athletic, and she had these swollen lymph nodes, right? And the doctor just said, well, I'm sure it'll pass, right? So she lost a year in terms of getting care. It turned out to be cancer.
Oh my.
And there's so many stories like that where people are just, oh, that's normal, or you'll get over it, or you're too young, those kinds of things. So I'm glad you're making the point that people really need to advocate for themselves.
Yeah, and question. I mean, doctors are only doctors. Just question them and ask for a second opinion. Ask for a third opinion if you have to.
Exactly, exactly. So tell me, based on your experience, what systemic changes could make a big impact in terms of improving healthcare outcomes for Black women?
Well, I think our physicians have not been trained culturally for cultural competency and how to speak to Black women, but also to know that we are different in terms of how we respond to certain kinds of treatments and what we should be getting. And so I think that making sure that, first of all, if you can find a Black physician, that's first of all, do that. But if not, then again, as I mentioned, question the doctor about other kinds of care and go in prepared by doing your research ahead of time.
That's a great point. I'm thinking right now of the experience with my mom and sister. They both had cancer. And actually, they're the source of my inspiration for doing all of this work. I was my sister's primary advocate, and I didn't even learn about immunotherapy until I was helping a non-Black friend a little bit later. You
Mm,
know, it was never an option presented to my sister.
right.
So I think those kinds of things really point to why it's important to do your own research and why it's important to seek support from organizations that really specialize in supporting Black women on the journey.
Right. And it's important to know that now there are a number of physicians who are promoting research specifically for African Americans, particularly in breast cancer, for example. Because again, as I mentioned, the treatments are different, the medications are different. And so if you can get into a clinical study, that's important because that gives the medical community different data to deal with how to treat us. So that's very important.
Exactly. As a matter of fact, Touch Breast Cancer Organization, they have a hashtag, Black Data Matters.
Ah,
Black Data Matters. And I think that is really right on point.
yeah, one of the other things I'd like to mention too is the American Red Cross, for example. They have a sickle cell blood drive. We don't get a lot of donations done. I donate every 3 months for sickle cell, specifically for sickle cell. And so we need to get those blood drives out so that people know this is important for the health of our people.
Beautiful. Thank you for mentioning that. So let's move on to your work on Black ladies advocating for cancer care, which is how we met because
Exactly. Yes.
we were serving on a community advisory board together. And I just appreciate your leadership and the great ideas that you share and the suggestions you make during those meetings. So thank you for that. And I know that you are a core member of that group, one of the founding members of that group. So tell
Correct.
me what led you to join BLACC and what's the organization's mission and focus?
So BLACC really started, Black Ladies Advocating for Cancer Care, actually really started from a forum that was held in 2018 by Stanford Cancer Institute and Stanford School of Medicine. And so they convened this group, and there were about 40 women, primarily African American, who came with the goal of raising awareness around breast cancer and breast cancer research. And so we met. And then after that meeting, and they gave us all the information, they asked folks who wanted to continue. And a number of us continued meeting. And in 2020, we formed a community partnership that was academic and collaboration with Stanford School of Medicine. And we were funded with a grant from the California Breast Cancer Research Program. And it was administered by the University of California Office of the President. So that first year, we spent our time developing and planning what would a peer navigator program look like for Black women who were going through the cancer journey. We finished that after a year through interviews and doing all the data, and we ended up publishing a report. And then the subsequent year, we got funded again. And so now we're in the second year of finalizing that program, and it has really turned out to be a really wonderful program for folks. So again, my love for healthcare. I actually have had family members who have gone through the breast cancer journey. And so it was important for me also because I have 3 daughters and 8 granddaughters. So I am
Wow.
constantly, sending them information. Are you doing your breast exams? Here's some information you need to know. So that's why it's important. And I'm a Black woman too. And we have late stages of breast cancer. So it's important to understand and know what to look for, what to feel when your body doesn't feel right. Question it.
Yeah, that's really great advice. So, the peer navigation program, that is a program where the person who is going through the cancer journey
Mhm.
is given support in some way. Can you talk a little bit about what that might look like?
It looks like having a buddy. It's a buddy system. So
Hmm.
that person is there to help the person who is going through the journey understand what's available, provide the resources for them, assist them if they need someone to go to the doctor with them. Remember the questions to ask, question about the medications, and then just to be there as a support system. If you need to call me and you're not feeling good that day, call me. I'll be there for you. Helping the family to understand what they're experiencing and what they need to do in terms of their support. And then this year, we had a partnership with Charlotte Maxwell Clinic, which provides free services for women who are going through a cancer journey. And there they can get free massages and other kinds of holistic treatments.
Yes, acupuncture and Reiki and herbal support. Yeah, it's a really great partnership. And I'm really delighted because we're also partners with Charlotte Maxwell Clinic for the Love Letters to Our Bodies project. So,
Oh, that's wonderful. I did not know that.
yeah, and that's actually how I got to be a member of the board because Melbra Watts, who's the executive director there, invited me to join you all on the CAB board for the
Oh, okay.
BLACC.
All
Yeah.
right. Something behind the scenes that I didn't know. Yeah.
Yes. Yes. So, what have you learned about community building and support networks through your work with BLACC?
Well, community building is just really a very strong way to have advocacy and to get your points across or get things done for your organization or other organizations. So also it provides an opportunity to share resources and to share knowledge, but to bring people in who have like-minded resources, but also information and building that capacity.
Great, great. Thank you. So let's move on to cancer care and support. Like, what are some misconceptions about cancer care in the Black community that you've worked to address or that you've been aware of and spoken out about over the years?
Well, I think the first thing is that Black women don't talk about it. They don't share that they have been diagnosed. They hide it. And the first thing that needs to happen is that you talk about it, you make your family aware of it so that you can get the support, but also then you seek the appropriate providers so that you can get the care. So that's the bigger misconception. And then I think that the other thing is that asking for help is not a no-no. You need to ask for help.
The Love Letters to Our Bodies podcast is sponsored by Moyo Institute Incorporated, a nonprofit organization offering heart-centered educational experiences, and the Lloyd Symington Foundation, which supports visionary grassroots cancer programs. Yeah, in fact, some of the women attending the Love Letters workshops talk about the fact that they were always so focused on being the support giver, like really taking care of all of the problems in the family, all the issues, serving the needs of others. And this diagnosis really forced them into a position of having to learn how
Yes.
to receive support.
Yes. In our first session and our first grant that we received, it was interesting. We had 2 men who were taking care of their wives during the journey. And it was very interesting to learn how they had a whole different lens of looking at their wives once they understood what they were going through in terms of their journey, but they were extremely supportive. So that was really heartwarming to learn.
Beautiful, beautiful. And do you have examples of how proper advocacy would have changed or could have changed the outcome for someone on their cancer journey? Anything come to mind?
I don't have anything specific because I haven't been a peer navigator for anyone, but I would imagine that having someone to escort you or accompany you to a doctor's appointment and help you sort out what needs to be sorted out is probably very uplifting and lessens your stress level because then you can talk about that after the visit and then make sure that you understood what was said at the meeting and then what you need to do to move forward.
You're right. In fact, some of the women say that what's been really useful is having someone there to write down what's being said, because sometimes after you hear the word cancer, your mind just goes blank.
I
It's
can
almost
imagine.
like nothing after that is retained, that
Mhm.
fear is so strong. And then also just having the support in general. I was listening to a testimonial from a sister this morning, and she was saying that she found radiation to be the most difficult because she had to do it alone. You know, like when she was going through chemo, someone could be there with her. But
Yes.
when she was doing the radiation, she had to do that alone, and that was extremely difficult.
And another thing that they should be able to do is to learn how to journal.
Exactly.
Journal during a visit and after a visit, and when they're, like you say, getting their therapy or their treatments, just to sit there and write out their feelings and to have soothing music that will settle them and calm them down so that they can get through the process because it's a difficult process.
And also to really think about all the questions that they have in advance and write those questions down, because again, when they're talking to the physician, they may not think of everything that they meant to ask. And so,
Absolutely. Absolutely. And that's normal for any doctor's appointment. We all go in there and the first thing we do is listen to what he's saying. Well, how are you feeling? And there's such a sense of rushing that you don't have time to kind of really concentrate on the things that you want to know or you need to know.
exactly. Do you have advice for Black women who may be supporting a loved one diagnosed with cancer?
Be patient, be a good listener, and then just offer comfort and support.
Yeah. I found out with my sister, for instance, that sometimes I wasn't as patient, because she would call me for anything. But if I had to pick her up to take her to an appointment and she didn't feel like going, she wouldn't call me to tell me that.
Oh, okay.
You know? And I understand after the fact it's because she just really wanted me to be there, right?
Yeah,
But
yeah.
I would sometimes like get up at 6 in the morning and drive halfway across town to pick her up, and she'll say, "I'm not going today." So, yeah, I agree with you. Patience and really understanding between the lines what's not being said,
Exactly.
but
Mhm.
the fears that are there that are maybe being held closely to the body is also a help as well.
And be sure that you understand the words that you say are important. Say things like, what can I do to make you feel better? Or what do you need? Or how can I be of support? Those kinds of words instead of being, well, how come you're not going this morning? Or why don't you know? You know you
Exactly.
need to go there. If you don't do this, you're going to have this. No, no. Their body and their mind is in a state where no, they're just tired. And it's easier to say, I understand you're tired, but you need to also understand that if you don't get this, it's going to be a little setback for you. So, how can I help you get the strength to go? And what can I do for you?
Exactly. Exactly. I wish I had you on my shoulder then. But I'm making up for it now in terms of helping other
Yes.
women to be better at this whole process of support. So
Yeah. Yeah.
thank you for that really wise, wise counsel. So, how can we be better prepared to be advocates in the healthcare settings for ourselves and our loved ones?
Well, sometimes we aren't prepared and it's hard to be prepared. But when the situation presents itself, I think we just need to sit down and say, what is it that I need to know? What is it that I need to do? And how can I do it? And who do I need to bring along with me to help me get through this?
Excellent, excellent suggestions. Thank you. So, what practices have you adopted for your own health and well being while doing this emotionally demanding work?
Well, I lost my sister to cancer in August.
I'm
So,
so sorry.
yeah, so that was very difficult. I didn't learn from her that she actually had lung cancer until we were on our trip to Greece, and we landed in Greece. And she said, I've got something to share with you. And I'm like, okay, what is this? And she had been coughing, and I kept telling her, you need to go to the doctor. That cough is lasting too long. And that's when she revealed to me that she had lung cancer. So we made the trip, and then she came home, and then she was on another trip to Thailand. But when she returned from Thailand, that's when her condition went downhill. And it was at that time that I was really trying to speak with her when she could speak to try and comfort her. But, it was something that I thought, how could this be happening? But I tried to be upbeat with her and to try and talk with her and say, is there anything you think I should know that I need to help you or the family with? So I was trying to be supportive that way. For my personal, I'm just trying to, I pray a lot. I pray a lot.
Hmm.
And I try to stay centered. I try to reach out to people that I know who might be able to help me or get me some resources. And I read a lot. So I don't know that you're ever prepared for that. It happens, and sometimes it happens so quickly that you don't know how to react and you don't know how to grieve after the fact. So,
Hmm.
people say self care. It's hard to do self care. That's
Hmm.
hard work.
Well, I heard you saying something about you like going for massage also.
Oh, I do. The National Holistic Institute offers the greatest massages for the best price for seniors. And I go online, and whenever there's an opening, I take it. They offer both shiatsu and Swedish, and they're hour massages, but they're worth your time and your money.
Beautiful, beautiful. So, yeah, self care is important, especially for caregivers, because often, we're so involved in supporting the person who's with the primary diagnosis that we forget to take time to rebuild and regenerate our own inner resources, our own strength as well. So, I think that recognizing that self care is important for the patient, the person going through the experience, and for the caregiver. So,
Absolutely. You're absolutely correct. Yeah.
mhm. So what gives you hope when facing the challenges in our healthcare system?
What gives me hope are programs like what you're promoting, which I applaud you for. Programs like Black Ladies Advocating for Cancer Care, the ability to have partnerships with organizations like Stanford School of Medicine, and reaching out to the National Medical Association, for example, which are the group of our Black physicians. We need to tap into them. The Association of Black Nurses, tap into them. And then to just continue to have our voices out there. Again, we are the population that has the highest incidence of really critical diseases. And we need to make sure that our community understands that we provide the resources so they can correct that, correct their eating habits. Where there are food deserts, what can we do about that? How do we partner with the American Heart Association, the American Cancer Association? They all want to do that and have diverse markets. And so we need to make sure that we are doing those kinds of things in terms of advocacy.
Yeah, great, great, great. Thank you for that. So, do you have a definition of healing beyond the traditional medical framework?
I tap into holistic
Hmm.
approaches.
Hmm.
I mean, I've always known about them and good old fashioned medical treatments that you learn from your grandparents, all of
Hmm.
that. And so I'm learning more myself. I'm certainly not an expert at it, but I do tap into using frankincense oil, for example, understanding where the minerals are important, how magnesium is important for you, how having vitamin D, getting out in the sun, making sure you get that vitamin D, even if it's like 20 minutes, get out and have that. If you're able to walk and exercise, do that. But yeah,
Hmm.
just round it out the best way you can, the best way your body can manage it and your mind.
Yeah, exactly. And one of the things we talk about in our workshop is the difference between healing and curing. For instance, a curing is really what the traditional or the mainstream medical system does in terms of eliminating symptoms. And what we also really try to get women to focus on is underlying causes. Like sometimes there are emotional components. Sometimes there's been trauma in the life that got stored in the body. And that healing is sometimes those two things work in companionship with each other, but sometimes you may be healed and not get cured. You may be cured and not get healed, right? So
Right.
that we really look at restoring balance in the thinking process, in the way we approach living, and our compassion for ourselves. So all of that contributing to healing as
Yeah, 'cause
well.
sometimes that mental health trauma gets buried. And so you have to sometimes recognize if there are triggers that's bringing that forward that's going to impact how you function. And so, this whole thing around mental health is really critical right now
Hmm.
because there are things that may have happened to you as a child that got buried or, even as an adult that you buried because you wanted to move on. But seeking help for that is important.
Hmm. And recognizing that sometimes these things inform your willingness to show up and ask for support, and that we really just have to push through those reservations to get the help that we need.
And having someone to talk to, whether it's just a friend or a buddy. I mean, I have what I call my BFF that I've known since high school, and we have coffee once a month, and we share our stuff, and that's healthy for us. There are times when we've cried. She lost her husband about 4 years ago, but she's still trying to move on, and so I've been her support system. My husband is going through some medical things. She's been my support system, so having that is really important.
Absolutely. So, what does loving our bodies mean to you, both personally and in your professional capacity?
For me, it means staying in tune with my body, listening to it. Like I know that I should seek periodically some counseling. And I've done that. And then I think, oh no, I can handle this. And I'm thinking, okay, no, you really can't handle it. So go ahead and go back, make the appointment. But just sort of listening to my body is what I've done most of all in the evening. After a full day's work, when I sit down, it's like, how does my body feel? Is it aching? Is my mind spinning? When I'm sleeping or trying to sleep, is my mind spinning? Why is that? So trying to learn how to breathe appropriately, try to recognize, don't eat late, don't eat heavy foods before I go to bed. Those kinds of things. And those are simple things, but sometimes we get in such a rut that we're just rushing to do everything and you can't do everything and you can't be everything for everybody. So make yourself a priority so that you can be there to take care of someone else if the need arises.
Yeah, beautiful, beautiful. Thank you for that because those are things that we might not even think about, right? But they're simple that can be incorporated into our daily lives. So thank you for those wonderful observations. What exciting developments do you see on the horizon for improving cancer care for Black women?
I think there's a heightened awareness that we're more concerned about the disease as a community. And then I think that we have advocates who are stepping up for us. And I think that's exciting in itself. Your program, for example, the other programs that are out there where we're focusing specifically on Black women. So that's encouraging. And I think that we have physicians who are also stepping up. We have more Black women who are giving information, like Dr. Candace Johnson. I love her because she's just so informative, easy to understand, but is very passionate about her work of breast cancer in African American women.
Mhm. Beautiful, beautiful. So, if our listeners take just one action after hearing our conversation today, what would you want that to be?
Be your own self advocate.
Excellent, excellent. Thank you. How can people support the work of BLACC or get involved?
Well, they can visit our website, and then when we publish events, they can show up and we can make sure that we get you the information to post in terms of our website and whenever we're having activities. So show up and come and tell their stories, share their stories with us. And, when we need to add people to our community advisory board, be there so that we can hear your voice and hear your experiences.
Beautiful. Thank you. So, what legacy do you hope to leave through your work in healthcare and advocacy?
I think my legacy is that I cared enough to step up.
Thank you so much. And I think that says it all. And it's so, so important to be willing to step up and do what's necessary.
Mhm.
And what I love about the things that you shared today is that it's stepping up in ways that are unusual and ways that are customary. And you show up in your personal life for friends, you show up for yourself, you show up for the community with the work that you're doing in advocacy and the work that you've always done in healthcare leadership and management and capacity building. And so I just want to applaud you and thank you. Thank you for being willing to go beyond the initial introduction into healthcare and also for making sure that your daughters and granddaughters are aware of what they need to know in order to be healthy.
Thank you so much. I appreciate the opportunity, and I'm going to listen into your podcast so I can continue to learn.
Thank you. Thank you. And we'll make sure that all of the websites and contact information is available in the show notes so people can be in touch if they'd like to.
All
Thank
right.
you.
Thank you so much. Bye-bye.
That's a wrap. Thank you so much for listening to Love Letters to Our Bodies, conversations on health, healing, and happiness. To find out more about the Love Letters to Our Bodies project, visit our website at moyoinstitute.org. That's MOYO Institute.org. Follow us on social media and subscribe to the podcast so you don't miss an episode. If there are topics you'd like for us to discuss, let us know. Remember, your body is beautiful, girlfriend. Love it.